have you ever wondered if the pills you take every day might be quietly doing more harm than good? As we grow older, taking multiple medications becomes almost routine. But here's the catch. What many older adults don't realize is that certain drug combinations can interact in ways that are downright dangerous. We're not just talking about mild side effects like nausea or dizziness. Some interactions can cause serious issues like internal bleeding, kidney damage, or sudden drops in blood pressure. The truth is, our bodies change with age. Our liver and kidneys process medications more slowly, and what once was safe on its own can become risky when mixed with something else. Sometimes, two medications that seem harmless by themselves can become harmful together. The worst part? These issues often go unnoticed until symptoms appear, or worse, until an emergency happens. That's why it's so important for seniors to pay close attention to what they take and how those things interact. Even over-the-counter drugs or vitamins you don't think twice about could interfere with your prescriptions. Unfortunately, not every doctor flags every possible interaction, and with multiple specialists involved, it's easy to forget who prescribed what. But here's the good news. There are safe, natural options that may help reduce your reliance on medications, and they work gently with your body. In today's NutriHub Bliss video, we'll uncover 5 medication combos seniors should never mix and explain the red flags to watch for. Then we'll share 5 doctor-friendly natural alternatives that support your health without putting you at unnecessary risk. So grab a pen and paper. This simple knowledge could protect your health, lower your risk, and give you peace of mind. Let's get started. 1. Blood thinners. The hidden danger of mixing warfarin and aspirin. Have you ever been told to take something just in case for your heart, like low-dose aspirin? Or maybe you're already on a prescription blood thinner, like warfarin, to prevent stroke or heart attack. But here's something most people aren't warned about. Combining these two medications without medical supervision can be extremely dangerous, especially for older adults. Let's break it down. Warfarin is a powerful anticoagulant that slows the blood's natural clotting process. It's commonly prescribed to seniors to reduce the risk of life-threatening clots, strokes, and heart attacks. On the other hand, aspirin, even in small doses, is often taken for mild pain, inflammation, or heart protection. Sounds harmless, right? But here's the catch. Both drugs thin your blood, but in different ways. Warfarin blocks the liver's ability to make certain clotting proteins, while aspirin prevents blood platelets from sticking together. Taken together, they don't just double the blood thinning effect, they multiply it. That means even a small cut could lead to excessive bleeding. Worse, bleeding could happen inside the body without any visible warning. Internal bleeding might show up as black stools, vomiting blood, or severe abdominal pain, but in more serious cases, it could cause a brain bleed, triggering confusion, a sudden headache, slurred speech, or collapse. For seniors whose blood vessels may already be fragile, this combination can be life-threatening. And that's why doctors urge caution. If you're taking warfarin, do not add aspirin or other blood thinners, even over-the-counter ones, without speaking to your healthcare provider. There are specific situations where doctors might prescribe both, but it requires close monitoring. You'll likely need regular INR blood tests to make sure your blood isn't getting too thin. Without this careful supervision, the risks far outweigh the benefit. It's also important to remember that some natural supplements can act like blood thinners too. Fish oil, vitamin E, turmeric, ginkgo biloba. These may seem harmless, but they can increase bleeding risk when combined with warfarin. That's why it's crucial to tell your doctor about everything you take, even if it's not a prescription drug. Want to stay safe? Start by keeping a written list of every medication and supplement you take and bring it to every appointment. Use a pill organizer to avoid mixing up your doses, and consider wearing a medical alert bracelet that says you're on blood thinners. This could save your life in an emergency. Taking care of your health doesn't mean avoiding medication, but it does mean staying informed. Knowing which combinations to avoid could be the key to preventing a serious complication. And that's exactly why we made this video. Beta blockers and insulin, a risky mix for blood sugar control. If you're living with both heart disease and diabetes, as many older adults are, chances are you may be taking a beta blocker and insulin at the same time. On their own, these medications are incredibly helpful. Beta blockers slow your heart rate and lower blood pressure, which protects your heart. Insulin helps regulate your blood sugar and keeps your diabetes under control. But when taken together, that's where things get tricky and potentially dangerous. Here's what you need to know. Beta blockers can hide the warning signs of low blood sugar. That's a big deal because when your blood sugar drops too low, a condition called hypoglycemia, your body normally sends out loud and clear alarms. Shaky hands, sweating, dizziness, confusion, or a pounding heartbeat. But when you're on a beta blocker, many of those early symptoms may not appear at all. You could be having a serious blood sugar crash without even knowing it, until it's too late. That's when things can take a turn for the worse. Fainting, falling, mental fog, or even unconsciousness. What's more, beta blockers don't just hide the symptoms. They can actually make hypoglycemia worse by slowing the liver's response to raised blood sugar levels. This double effect makes it harder for seniors who rely on insulin or diabetes medications to manage their glucose safely. And with age, the body becomes even slower at bouncing back from these drops. This combination can be especially risky for older adults living alone, those with memory challenges, or anyone who doesn't check their blood sugar frequently. You may not feel the crash coming until you're suddenly too weak to react, and that's a dangerous place to be. So what can you do? First, if you've been prescribed both a beta blocker and insulin, don't panic, but do stay proactive. Make sure you or your caregiver check your blood sugar regularly. Even if you feel fine, pay close attention to subtle signs like unusual fatigue, slight headaches, or unexplained sweating. These could be your body's quieter signals that something's off. Second, always have a fast-acting sugar source nearby. Glucose tablets, fruit juice, or a small piece of candy can be lifesavers if your blood sugar dips suddenly. Keep them in your pocket, purse, or nightstand, wherever you'll have quick access. And finally, talk to your healthcare provider about your medications. Ask whether any adjustments should be made or whether a continuous glucose monitor, CGM, might be helpful. Sometimes safer combinations or timing changes can make a big difference in managing both your heart and your blood sugar. 3. Opioid painkillers and benzodiazepines, a silent danger to your breathing. As we age, dealing with chronic pain and anxiety becomes a part of life for many. That's why medications like opioid pain relievers and benzodiazepines are commonly prescribed to older adults. Opioids such as oxycodone, morphine, or hydrocodone are often used after surgery, injury, or for ongoing pain like arthritis. Benzodiazepines, such as Valium, Xanax, or Ativan, are used to calm anxiety, ease insomnia, or relax tense muscles. Individually, these medications can be helpful when used exactly as prescribed. But taken together, they can create a high-risk combination, one that may quietly affect your breathing and your brain. Here's why. Both opioids and benzodiazepines slow down your central nervous system. That means they affect the part of your body responsible for breathing, heart rate, and mental alertness. When used at the same time, their effects don't just add up, they multiply. This can lead to respiratory depression, a condition where your breathing becomes dangerously slow, shallow, or may even stop entirely for short periods. For older adults who may already have reduced lung capacity or hidden respiratory issues, this can quickly become a life-threatening emergency, even at low doses. And that's not the only concern. This drug combo can also cause severe drowsiness, confusion, memory loss, and poor coordination. These side effects greatly increase the risk of falls, fractures, and hospitalization, which are already leading causes of injury among seniors. Imagine standing up and suddenly feeling so groggy or dizzy that you can't steady yourself. It's more than discomfort, it's a real threat to your independence and safety. To make things worse, the aging body processes medications more slowly. Your liver and kidneys, the organs responsible for clearing drugs out of your system, don't work as efficiently with age. That means even normal doses of opioids and benzodiazepines can build up in your bloodstream, reaching toxic levels over time. Another common issue, many older adults don't even realize they're taking both types of drugs. One doctor might prescribe an opioid for back pain, another might give you something to help you sleep. And over-the-counter sleep aids can also contain ingredients similar to benzodiazepines, adding to the effect without you knowing it. That's why it's so important to keep an updated list of every medication you take, including non-prescription items, herbal supplements, or vitamins, and share it with every doctor or pharmacist you see. Even one missing detail can make a big difference. If your loved one has been prescribed both an opioid and a benzodiazepine, never adjust your dosage without talking to your doctor first. Avoid alcohol and any other sedating substances, as they can make the risks even worse. For diuretics and NSAIDs, a dangerous duo for your kidneys. For many older adults, diuretics, often called water pills, are a daily part of managing high blood pressure or swelling from heart, liver, or kidney issues. These medications help your body flush out excess salt and fluid through urine, easing the burden on your heart and lowering your blood pressure. At the same time, NSAIDs, or non-steroidal anti-inflammatory drugs like ibuprofen and naproxen, are commonly used to relieve everyday aches and pains. Whether it's arthritis, a sore back, or inflammation from a minor injury, NSAIDs are often seen as a go-to remedy. But when these two medications are used together, they can quietly damage your kidneys, sometimes beyond repair. Here's why. Diuretics work by increasing urine production, which helps remove excess fluid. But in doing so, they also flush out vital electrolytes like potassium and sodium, elements your body needs to stay balanced. NSAIDs, on the other hand, work by blocking enzymes that cause inflammation, but they also reduce blood flow to the kidneys. That means your kidneys get less oxygen and nutrients, making it harder for them to filter waste. Now imagine what happens when both of these effects hit at once. You're losing important fluids and electrolytes from the diuretic while the NSAID is choking off the blood supply to your kidneys. It's a perfect storm, and it can lead to acute kidney injury, which is a sudden and severe drop in kidney function. The scary part? This kind of kidney damage often comes with few or no early symptoms. You might not feel a thing until your body starts showing subtle signs. Swelling in your ankles, feeling more tired than usual, having less urine output, or even shortness of breath. And for older adults, whose kidneys naturally slow down with age, this kind of damage can progress quickly and quietly. That's why it's so important to stay alert and informed. If you're taking a diuretic, talk to your doctor before using any NSAID, even over-the-counter ones. It might seem harmless, but the combination could be putting your kidneys at serious risk. Instead, ask your healthcare provider about safe alternatives for pain relief like acetaminophen, Tylenol, or other non-SAID options that are easier on your kidneys. And if you need long-term pain management, your doctor can help you build a plan that works without compromising your kidney health. At Elder Care Wellness, we believe in smart, simple choices that protect your long-term health. Keeping a current list of all your medications, including over-the-counter pills and herbal supplements, and sharing it with your healthcare team is one of the best things you can do. Remember, your kidneys work hard for you every day. Let's return the favor by treating them with care. 5. Antihistamines and SSRIs are hidden risks for confusion and falls. For many older adults, managing allergies, trouble sleeping, or depression is a daily concern. That's why medications like antihistamines and SSRIs, selective serotonin reuptake inhibitors, are often part of the picture. First-generation antihistamines like diphenhydramine, known commonly as Benadryl, are used for allergies, but also as nighttime sleep aids. SSRIs, such as fluoxetine, Prozac, sertraline, Zoloft, or Cetylene, and Celexa are widely prescribed to treat depression and anxiety. Each medication on its own can serve an important purpose, but when taken together, they can create a risky mix, especially for seniors, by increasing the chances of confusion, dizziness, and falls. Here's why. Antihistamines, particularly older ones like diphenhydramine, have strong sedative effects. They can make you sleepy, foggy-headed, and unsteady on your feet. SSRIs, while helpful for mood, may also cause side effects like fatigue, dizziness, or slower thinking. When combined, these effects don't just add up, they intensify. The result, a higher risk of mental cloudiness, slower reflexes, and dangerous missteps. And for older adults, this is more than an inconvenience, it's a serious health concern. Falls are the leading cause of injury and hospitalization in seniors. A single fall can lead to a fractured hip, a head injury, or even long-term loss of independence. The road to recovery from a fall can be long and difficult. But the risks don't stop at physical injury. The combined mental side effects, memory problems, confusion, and slower thinking, can also impact your quality of life. If you already experience mild cognitive issues or are in the early stages of dementia, these medications may worsen your symptoms. Now, many people assume that because antihistamines are sold over the counter and SSRIs are commonly prescribed, using both is perfectly safe, but the reality is more complicated. First-generation antihistamines may seem harmless, but when taken regularly or in high doses, especially for sleep, they can significantly affect your brain's clarity. That's why it's so important to talk with your doctor if you or a loved one is using both types of medication. There may be safer options. For allergies, second-generation antihistamines like loratadine, Claritin, or cetirizine, Zyrtec, have fewer sedative effects and are gentler on the brain. For sleep issues, non-drug strategies such as sleep hygiene routines, light therapy, or gentle movement like evening stretching may offer relief without the risks. When it comes to depression or anxiety, your doctor may be able to adjust your SSRI dose or suggest a medication with fewer sedative side effects. In the meantime, it's smart to avoid driving or operating machinery if you feel drowsy or off balance. At Elder Care Wellness, we believe staying informed is the first step towards staying safe. With the right questions and a little extra care, you can avoid unnecessary risks and feel more confident in your daily life. A safer path, natural alternatives for seniors. Now that we've talked about 5 dangerous drug combinations older adults should avoid, let's shift gears and explore natural, safer alternatives that can help support your health without the same level of risk. But let's begin with one of the most powerful natural tools out there, omega-3 fatty acids, commonly found in fish oil. If you've been relying on over-the-counter pain relievers like ibuprofen or naproxen to ease stiff joints or reduce chronic inflammation, omega-3s might be a gentler, more senior-friendly solution worth exploring. Unlike NSAIDs, which can irritate the stomach, raise blood pressure, and harm the kidneys over time, omega-3s work with your body, not against it. So how do they help? Omega-3s reduce the body's production of inflammation-causing substances. That means they can help ease swelling and pain associated with arthritis and other inflammatory conditions without the stomach ulcers or kidney risks that often come with long-term NSAID use. For older adults managing chronic discomfort, this makes omega-3s a safe and supportive option for everyday relief. But the benefits don't stop there. Omega-3s are also known for their heart protective power. They've been shown to lower triglyceride levels, gently reduce blood pressure, and improve the flexibility of blood vessels, key factors in keeping your heart and circulatory system running smoothly. Since heart disease remains a leading cause of death among seniors, adding a trusted omega-3 supplement to your wellness routine could make a meaningful difference in your long-term heart health. And even more impressive, omega-3s may also help protect your brain. Research suggests that these healthy fats support cognitive function and may even help slow the progression of age conditions like Alzheimer's or mild cognitive impairment. For many older adults, that's not just helpful, it's empowering. Supporting both brain and heart health with a single supplement is a rare and valuable advantage. Of course, not all supplements are created equal. When choosing a fish oil supplement, look for one that's been purified to remove heavy metals and other toxins. This is especially important as we age. Ideally, choose a product that offers a combined total of 1,000 to 3,000 mg of EPA and DHA per day, the 2 key types of omega-3s responsible for these health benefits. And as always, talk to your doctor or pharmacist before starting any new supplement, especially if you're already taking prescription medication. At Elder Care Wellness, we believe in finding balance, supporting your body naturally where possible, and using medication carefully when truly needed. Omega-3s are just one of many natural tools that can help you live more comfortably, safely, and confidently. Stay tuned as we continue exploring other natural options to support your joints, brain, heart, and more, because staying healthy shouldn't have to mean putting your body at risk. Turmeric porcupine against pain and inflammation. If you've ever cooked with curry, you've likely used turmeric, that bright golden spice that gives Indian dishes their beautiful color. But turmeric isn't just for flavor. It's been treasured for centuries in traditional medicine, and today science is backing it up. At Elder Care Wellness, we believe in the power of natural remedies that are both gentle and effective, and turmeric is one worth talking about. The real magic in turmeric comes from curcumin, its main active ingredient. Curcumin has potent anti-inflammatory and antioxidant properties, making it one of the most researched natural compounds for managing pain, especially the chronic kind many seniors face from conditions like arthritis, joint stiffness, or muscle. So what makes curcumin so special? Unlike common over-the-counter pain relievers that simply mask pain, curcumin works deeper. It helps block the body's inflammatory response at the source, calming overactive immune signals and reducing swelling. That means it's not just hiding discomfort, it's actually helping your body fight the cause of it. For older adults looking for long-term relief without the side effects of NSAIDs like ibuprofen, curcumin offers real hope. Several studies have found that curcumin, when taken consistently, can improve joint function, reduce pain levels, and enhance mobility. In fact, in some clinical trials, curcumin supplements have shown results comparable to low-dose NSAIDs, but without the risks of stomach irritation, kidney strain, or increased blood pressure. And that's a big win, especially for seniors managing multiple prescriptions. Curcumin is gentle on the stomach and kidneys, making it a smarter long-term option for those looking to minimize medication overload or avoid risky drug interactions. But there's a catch. Curcumin isn't easily absorbed by the body. You'd have to eat a mountain of turmeric to get the full benefits. That's why most quality turmeric supplements include piperine, a natural compound found in black pepper that enhances curcumin absorption by up to 2,000%. Some products also use special formulations like liposomal or phytosome technologies to further improve bioavailability. If you're considering adding turmeric to your daily routine, look for a trusted, high-quality supplement that clearly lists curcumin content and includes absorption enhancers like piperine. And as always, speak with your healthcare provider before starting any new supplement, especially if you're taking blood thinners or other medications. Natural remedies like turmeric don't promise overnight miracles, but over time they can offer meaningful, steady support for joint health, inflammation, and even overall energy levels. For older adults who want to stay active and independent without depending on heavy-duty drugs, turmeric is a time-tested ally. At Elder Care Wellness, we're here to help you make informed, safe choices that support healthy aging naturally. Because feeling your best shouldn't come with a long list of side effects. Would you like me to continue with another natural remedy, like Mama? 3. Magnesium mantly, a gentle way to support blood pressure and improve sleep. As we age, some of the body's most important systems start working a little differently, and that's where magnesium comes in. At Elder Care Wellness, we often highlight simple, natural solutions that help seniors stay strong, sharp, and independent. And magnesium is one of the most overlooked minerals that can make a real difference. Magnesium is essential for over 300 processes in the body. It plays a key role in muscle and nerve health, blood pressure regulation, and even sleep quality, yet many older adults aren't getting enough. As we get older, the body naturally becomes less efficient at absorbing magnesium from food. Certain medications like diuretics or acid reducers, as well as chronic conditions, can also deplete magnesium levels over time. Mild magnesium deficiency is surprisingly common in seniors and may contribute to issues like high blood pressure, muscle cramps, poor sleep, and general fatigue. One of magnesium's greatest benefits is its ability to help relax blood vessels, making it easier for blood to flow. That means it can gently lower blood pressure without the harsh side effects of some prescription medications. High blood pressure is one of the most serious health risks in older adults. It raises the chances of heart attack, stroke, and kidney problems. Studies show that regular magnesium supplementation can offer a natural, non-invasive approach to support healthy blood pressure, especially when combined with good lifestyle habits like regular movement and a heart-smart diet. But magnesium isn't just good for your heart, it's also great for your sleep. If you find yourself tossing and turning at night, struggling to fall asleep or waking up too often, magnesium might help. It supports the production of GABA, a calming neurotransmitter that helps the nervous system wind down. For many seniors, magnesium promotes deeper, more restful sleep, which in turn improves mood, energy, and overall quality of life. Another big benefit, magnesium is well known for easing muscle cramps and spasms, which are common complaints among older adults, especially at night. Low magnesium levels can trigger painful leg or foot cramps that interrupt sleep and make movement uncomfortable during the day. A daily magnesium supplement can often help relax tense muscles, reduce cramps, and improve mobility. You can find magnesium in healthy foods like leafy greens, spinach, kale, nuts, seeds, beans, and whole grains. But if your appetite or digestion isn't what it used to be, it can be hard to get enough just from meals. That's why many seniors turn to magnesium supplements to meet their daily needs. If you're considering adding magnesium to your routine, choose a high-quality supplement like magnesium glycinate or citrate, which tend to be easier on the stomach and better absorbed. And as always, Talk to your healthcare provider before starting any new supplement, especially if you're taking medications for the heart or kidneys. At Eldercare Wellness, we believe that small, natural changes can lead to big improvements. Magnesium might be the gentle, everyday support your body has been quietly asking for. Or chamomile tea, a gentle herbal remedy for restful sleep and relaxation. If you've been tossing and turning at night or feeling more restless than usual, you're not alone. Many older adults struggle with sleep and anxiety, especially as life changes, routines shift, and health becomes a bigger focus. At Eldercare Wellness, we know how important quality sleep is, not just for energy, but for heart health, memory, and overall well-being. One gentle, time-tested remedy that's gaining renewed attention is chamomile tea. Made from the dried flowers of the chamomile plant, this soothing herbal tea has been used for centuries to promote relaxation, ease anxiety, and support deeper, more restful sleep. And unlike prescription sleep aids or sedatives, chamomile doesn't come with a long list of side effects. Chamomile contains a natural compound called apigenin, which works by binding to receptors in the brain. Similar to how some anti-anxiety medications function, the result is a calm, relaxed feeling that can help quiet a busy mind and gently encourage sleepiness. It's not overpowering, and that's part of what makes it so effective. You feel relaxed, not groggy. For seniors looking to reduce dependence on sleep medications or avoid morning drowsiness, chamomile is a smart, natural option. Unlike prescription drugs, which can sometimes leave you feeling hungover the next day or interfere with memory and balance, chamomile promotes sleep in a way that's light and restorative. And science is starting to catch up with what many have known for generations. Clinical studies show that drinking chamomile tea or taking chamomile extract can improve sleep quality, shorten the time it takes to fall asleep, and even reduce symptoms of generalized anxiety. That's especially helpful for older adults who may experience disrupted sleep cycles or increased worry due to health issues or life changes. But the benefits of chamomile go beyond sleep. It's also known for being gentle on the digestive system. If you occasionally deal with bloating, stomach discomfort, or indigestion, sipping a warm cup of chamomile tea in the evening can help settle the stomach while relaxing the body. It's a small act of self-care that can become a comforting nighttime ritual. To get the most out of chamomile, try making it part of your evening wind-down routine. Brew a cup about 30 minutes before bed, turn down the lights, put on some soft music or quiet background sounds, and let the moment tell your body it's time to rest. If you're considering using chamomile regularly and take medications for blood thinners or sedatives, talk with your doctor first. While chamomile is generally safe, it's always smart to double-check for potential interactions. At Eldercare Wellness, we believe that natural, mindful habits can help you sleep better, feel calmer, and live more peacefully. Sometimes the simplest solutions, like a cup of tea, hold the greatest power. 5. Probiotics, a natural boost for digestion and immunity. As we get older, keeping our digestive system and immune system in good shape becomes more important than ever. Digestive discomfort, nutrient absorption issues, and a greater risk of infections can all become part of daily life. That's where probiotics come in, a simple, natural way to support gut health that has powerful ripple effects throughout the body. At Eldercare Wellness, we're always looking for gentle solutions that help you stay healthy without relying solely on medications. Probiotics are live, beneficial bacteria and yeasts that can help restore the natural balance in your gut, where trillions of microorganisms work together to keep your body running smoothly. Over time, that delicate balance can get thrown off. Aging, antibiotics, poor diet, or stress can all disrupt the gut microbiome, leading to common digestive issues like bloating, gas, constipation, or diarrhea. But the effects go deeper. An unhealthy gut can also weaken the immune system, making you more vulnerable to infections like colds, flu, and even urinary tract infections. Probiotics help by adding healthy bacteria back into the gut, supporting better digestion and stronger immunity. They improve the breakdown and absorption of nutrients, soothe the digestive tract lining, and crowd out harmful bacteria that can make you sick. For older adults, this means fewer digestive complaints, better nutrient absorption, and more energy for doing what you love. Scientific studies show that probiotics can reduce symptoms of irritable bowel syndrome, IBS, shorten episodes of antibiotic diarrhea, and even support a healthier immune response. In fact, some research has found that people who regularly take probiotics experience shorter, milder colds and fewer urinary tract infections, two common issues that affect seniors more than younger adults. So, how can you get more probiotics in your life? Some everyday foods are rich in probiotics, including yogurt with live cultures, kefir, sauerkraut, kimchi, and other naturally fermented foods. But if you're not eating these regularly, or if you've recently taken antibiotics, a probiotic supplement might be a smart choice. These come in capsules, powders, and even liquid drops. When choosing a supplement, look for trusted strains like Lactobacillus and Bifidobacterium, which are backed by research and known to support digestive and immune health. The label should list the number of live cultures measured in CFUs or colony-forming units, and the product should be stored properly to ensure potency. And of course, just like any health decision, it's best to talk to your doctor or pharmacist before starting a new probiotic, especially if you have immune conditions or take multiple medications. Your healthcare provider can help you find the right strain and dosage for your specific needs. At Elder Care Wellness, we believe that a healthy gut is the foundation of a healthy life. Whether you start with a spoonful of yogurt or a quality supplement, adding probiotics to your routine could be the quiet but powerful change your body has been waiting for. Conclusion, a healthier path, one thoughtful step at a time. As we've explored today, staying healthy as we age isn't just about managing the medications we take. It's also about discovering gentler, natural options that can support our well-being and reduce unnecessary risks. We began by uncovering 5 common medication combinations that older adults should be especially cautious with, from the dangerous bleeding risks of combining blood thinners and aspirin to the hidden dangers of beta blockers with insulin and the increased risk of confusion and falls when antihistamines are paired with antidepressants. Knowledge truly is the first line of defense. But just as important is knowing that there are natural alternatives that may help you feel better while minimizing your reliance on certain medications. We've talked about omega-3 fatty acids from fish oil, which fight inflammation and protect your heart and brain. We introduced curcumin from turmeric, a natural anti-inflammatory. Magnesium can help with muscle relaxation, blood pressure, and sleep. And chamomile tea supports calmness and better rest, while probiotics restore balance in your gut and strengthen immunity. When used thoughtfully, these natural choices may lead to fewer side effects, reduced medication interactions, and better overall quality of life. However, it's important to remember that natural doesn't always mean risk-free. Always speak with your doctor or pharmacist before starting any new supplement or changing your medication routine. Your healthcare provider knows your full history and can help guide you safely. Also, take charge by staying organized and informed. Keep a current list of all your prescriptions and supplements. Share it with your healthcare team. Speak up if you notice new side effects or changes in how you feel. Even small shifts, like swapping in a safe herbal remedy or avoiding a risky drug combo, can bring big improvements to how you feel each day. Thank you for joining us here at Elder Care Wellness. We're proud to be your partner on the journey toward healthier, safer aging. Remember, living well isn't about perfection. It's about making wise, informed choices, one step at a time. Stay safe, stay curious, and most of all, stay empowered.